progressives believe that a Medicare for All system can save taxpayers $5 trillion. Let's jump into these numbers and see if that's even possible. What progressives want is to nationalize the healthcare system and have it all run by the government. Get rid of all of the insurance, get rid of all the insurance companies, and have all of your healthcare costs managed by the government. And what that will do is that will allow people to basically have unfettered health insurance, to go to whatever doctor you want, anytime you want, and get the service that you need. Now, the problem with this, first of all, if you're on the other side of this argument and you decide or you take the stand that this is not a good way to do healthcare, you are automatically labeled as, a baby killer, as somebody who hates humanity, somebody who hates people. And sure, there might be some truth to that. I mean, who doesn't hate somebody, from time to time? Has anybody not driven on a freeway at any given point, gotten, in any kind of road rage situation and flipped off or said some kind of obscene thing to a complete stranger? Oh, but at the same time, you believe that person should have health care. You yelled at a person in a car, you go, I'll fucking kill you, because they didn't put on their left turn blinker when they moved into your lane. You threatened death upon that person, you flipped them off, but you think they should be able to go to the doctor to take care of their rheumatoid arthritis without having to pay a high deductible. Let me tell you something. If somebody cuts me off in traffic, I don't curse them out. I don't wish them death or some kind of terrible accident. I just say, you know what? You don't deserve health insurance. That's the kind of person I am. But what you start getting is you have people who believe that everybody should have access to the doctors. And, I believe it's is it the World Health Organization or the UN has labeled the right to healthcare a basic human right. So we're all on board that it's not that big of a jump to say that, people should have healthcare and everybody should have access to healthcare. But the controversy comes in when we start discussing, should everybody have access to Medicare? Should everybody have essentially free health insurance? Because healthcare and health insurance are two different things. Anybody, anytime, can go to a hospital and get an emergency service done, even if you don't have health insurance. The only problem is you don't have your insurance paying for it. But here's a dirty little secret of health insurance. And this comes from somebody who used to work in the industry. You can go to a healthcare provider without health insurance, assuming they'll take you, and most hospitals will take you. You can get whatever service you need done. And if you don't have health insurance, what they're going to do, one of two things. They're either going to give you the non-insurance rate, which is typically around 50% of what the regular rate is that they bill to insurance companies, or you can just get the bills and not pay the bills and get one step off from being sent to collections, and then they'll negotiate with you a lower price because they don't want to send that bill to collections. That actually loses the healthcare provider money. So right off the bat, you don't necessarily need to have health insurance to have access to healthcare. But I get it. That is kind of a slippery way of going about your healthcare needs. I get it. Not everybody wants to do that. So what do we do? Well, the proposal from the progressive side, people like, at this point, I believe everybody running for the Democratic nomination, most definitely made popular by Bernie Sanders. Now Elizabeth Warren has a Medicare for All plan. Andrew Yang wants Medicare for All. They all, Castro, who's the other guy? Buttigieg. All these guys, Biden, I don't know if Biden's fully on board with it, but most Democratic candidates want the Medicare for All option because, as a Democrat, this is what you want to tell people. I love you. I care about you. Come here, I'll give you a hug. I love you. And if you're Joe Biden, you get up in there, you sniff him a little bit, you maybe, slap him on the butt. You do all kinds of inappropriate things, but this is what the Democrats do. They get up in there and they really start to show you the love that they have for you. And so one of the things they're saying is like, look, everybody should have Everybody should have free healthcare. Who doesn't want to go to the doctor and be able to get all of these doctor services for free? Everybody should have that, right? The government should take care of us. Now, you start getting into these progressive policies, and this is where things start to go a little haywire. So I like to watch a progressive YouTuber named Kyle Kulinski, and he was actually talking about this.
The way the system works now is more expensive. If you do a Medicare for All system over the next 10 years, we save $5 trillion because you get rid of that unnecessary for-profit price gouging middleman. You get rid of that mafia, which is in between you and your doctor. You still get to pick your doctor, but there's no mafia that's in the middle taking an unnecessary amount of money from you. So the study from the University of Massachusetts Amherst says it saves $5 trillion over 10 years. That is a giant tax cut because guess what? Premiums, copays, and deductibles, all the stuff you have to pay to the private health insurance company, that's a tax. That's a private tax. We're talking about raising public taxes but eliminating the private taxes, so you're going to save a tremendous amount of money.
So Kyle is very unhappy with Nancy Pelosi because Nancy Pelosi, for as terrible as she is, isn't crazy about this whole Medicare for All thing. And she really starts to kind of skirt around the issue, and progressives like Kyle and Bernie, think this is unacceptable. And so what Kyle is talking about is, and he says this a lot on his own show, he's been on Joe Rogan talking about this, is that the beauty of Medicare for All is it cuts out this evil middleman that we call insurance. And what I like about Kyle is, as a progressive, he is very anti-Obamacare. He knows that Obamacare has been a complete disaster for the Democratic Party because the Obamacare was originally sold to us as possibly a Medicare for All, situation. But what it ended up turning out to be was an insurance mandate where it forced everybody into a marketplace where we had to buy insurance. And if you didn't buy insurance from one of these, one of the several companies that they deemed were, marketplace eligible, then you would get penalized. And what this has done is the complete opposite of helping control healthcare costs. It's made healthcare costs skyrocket on the insurance side alone because now you have essentially a cartel of insurance companies that don't compete with smaller insurance companies, don't compete with innovative insurance companies. It's just, the Blue Cross and the Anthem and the Kaiser Permanentes and, the old guard of insurance companies. So healthcare costs have gone up ever since the Affordable Care Act was enacted. So Kyle understands this, and progressives, I think, understand this. Now, where he starts to go off the rails a little bit is he's really bought in to this idea of if we pass Medicare for All, it's going to help people because everyone's going to have health insurance, which that's great, okay? But then it's going to also save the United States tax. It's going to save the United States economy $5 trillion, right? So essentially what this kind of math leads us to is saying, look, if we save $5 trillion in healthcare costs, then, then that's essentially a $5 trillion tax cut. That's really nice to think about. But there's a lot of misleading stuff in there. And every time you hear about Medicare for All, I'm going to tell you right now all of the things that they're leaving out of this equation, which is essentially why $5 trillion is not an accurate number. Kyle is quoting a report that was put out here by the Perry Institute at the University of Massachusetts Amherst, where they basically talk about what a Medicare for All plan would cost, all of the different elements to it, how it would be implemented. And what I find interesting is in the abstract, I'm going to go into the real report here in a minute, but in the abstract, this is like the highlight of the report. The report itself is 150 pages. So this is the part of it that they want to get picked up by news outlets. This is what they want everybody talking about. They didn't even put this $5 trillion number in there. That number has been extracted out, and I'll show you exactly where, by a lot of progressive news outlets as a talking point, okay? And it's a fair point to make. But what the Perry Institute actually says in this report is that Medicare for All could reduce total healthcare spending in the U.S. by nearly 10% to $2.93 trillion, because right now it's about $3.24 trillion. So really, we're saving what, $300 billion, which is, I mean, that's a lot of money. You know, I'm not saying that's not a lot of money, but when we're talking about $5 trillion, that is not the actual amount that's going to get saved on healthcare costs. When you start adding in all of these numbers like copays and deductibles, and you start talking about employer-sponsored healthcare and all of these different parts, this is where the $5 trillion number comes from. But that number is a lot more speculative than this number, because there's a lot of moving parts that need to make that $5 trillion number actually work. So here's the actual report, the full report. Again, it's very long. I don't think you would want to read it. You could read it, but it's going to take up a lot of your time. And I'll show you exactly where this $5 trillion number comes from. So you can see here in the macroeconomic impacts of Medicare for All, there's a lot of, talk about the macroeconomic impacts of the Medicare for All plan. And then down here, we find that over the decade of 2017 to 2026, the cumulative savings through operating under Medicare for All would be $5.1 trillion, equal to 2.1% of cumulative GDP. So this is where I start to kind of question what this report is actually talking about. Are they actually using data that they can quantify with real previous data? Or is a lot of this just speculative unicorn jizz? And a lot of me believes it's the latter, and I'll show you exactly why. So you can see right here, they're talking about establishing the universal right to decent health care. Under Medicare for all residents of the United States will have the opportunity to receive decent health care as a basic right. This will result through establishing a health insurance system that covers all residents in a manner comparable to the coverage now provided for residents 65 years old or older under the existing Medicare program. All healthcare consumers will also have the right to receive care from the providers of their choice. That's great, but we know that's impossible because there is a difference between a hospital, state-of-the-art hospital, like Mass General Hospital, and this hospital right here, the NYC Health Plus Hospitals in Amherst. Basically, the Amherst Hospital, which, has 2.1 stars. So, do you want to go to a hospital that has 2.1 stars on Google? Do you want to send your dying mother or father, or, maybe not even dying, but just parents with Alzheimer's or cancer or Parkinson's or, rheumatoid arthritis or whatever it is, to a hospital that has 2.1 stars? Methinks you don't. So what happens then if everybody just says, well, I've got healthcare coverage and I can just go to the hospital you want? Well, it's funny because in this report, the authors actually begin to discuss how they implemented these systems in other places with universal healthcare or with Medicare for All. At this point right here, the authors are talking about how we could transition into a Medicare for All system. And essentially what they're doing is they're giving us about 4 years to be able to transition into the system. And even in this report, the authors state that there's going to be a lot of problems that come with transitioning from our current system into this Medicare for All. Mainly that, well, if you had insurance and you liked it, well, now you're not going to have that insurance anymore. So there's going to be some serious complications as far as what doctors you can go to, what services you can get, what's covered, what's not covered, because essentially everything's covered. right? So maybe some services that you wanted to get before that you couldn't get before, they're now covered. Well, maybe those services cost a lot of money. So we have to tack that onto the cost as well. But specifically what I want to mention is that here, the authors use this example of the Taiwanese. Is that how you say Taiwanese? They talk about how Taiwan transitioned into a Medicare for All system. And in 1994, you see here, Taiwan successfully implemented a transition to its single-payer system in less than 1 year in 1994, and they make the point that it also happened without current IT capacities. Okay, so that's good news because we use Taiwan as an example. The problem is there is a lot of data that discusses what is the truth of what's happening in the Taiwan Medicare system. So here we have an evaluation that was done by the London Primary Care Journal back in 2010, basically talking about or giving an overview of the single-payer healthcare system, essentially the Medicare for All healthcare system in Taiwan, one of the quote-unquote advanced societies that have a Medicare for All system that we are severely lacking. Well, they talk about the weaknesses of this, of this single healthcare system, single payer system. And essentially, it all comes down to quality. What they're talking about here is that the quality of the care that you get in this Medicare for All system is really, really bad. Okay, so I'm just going to show you a little snippet here from this article. So there is a high level of health-seeking behavior in Taiwan. It is part of the Taiwanese culture to take medicines or to seek medical help frequently, even for minor ailments. The average outpatient department visit rate is 14 times per year per person. So the average person goes to the doctor in Taiwan for 14 times. To ensure their outcomes are maintained, seeing 50 patients in a morning is quite common for GPs in Taiwan. Hence, each patient may receive no more than 5 minutes of physician time during a consultation. Such short contact time may result in poor patient-physician rapport and inability to deal with complex problems in one visit. As a consequence, patients often attend for a second or third opinion, thus contributing to an even higher patient volume and higher medical costs. So the interesting thing about what's being proposed in this $5 trillion savings is using the status quo of how many times patients are going to the doctor right now. So typically a person should be going to the doctor maybe once or twice a year. Some people have severe problems and they go more times than that. But very rarely will you find a person, at least, in the kind of under 65 age range, or at least you would hope to find people under that age range that go to the doctor less than 14 times a year. 14 times a year per person to go see a doctor is astronomical. That is an insane amount of time. I would imagine those numbers that are being proposed in the Perry report are not factoring in a person having to go see a doctor that many times. Because if you're using the doctor that many times, each person is, well, the costs are going to mount up. No matter how free the healthcare is, it's got to be paid by somebody. And if people are going over and over and over again to the doctor, that means A, the care they're getting is not sufficient, especially because they're seeing a doctor for an average of 5 minutes. That's a huge problem. Right now in our in our medical system, doctors have about 15 minutes to see a patient. And subsequently, we are the 37th ranked healthcare system in the world. People are sicker than they've ever been in history of this country. And they're seeing doctors for 15 minutes. Now you're going to drop that down to 5 minutes a person. Not to mention all of these people who haven't been to the doctor in years are going to crowd and flood those offices. So 5 minutes might even be a little generous. That visit might just have to be a quick yo, doc, what's up? My leg's falling off. Doc's like, pop this pill. You're like, peace. Next. Also, let's think about this for a second. What medical school student wants to get a job that pays less because it's going to have to pay less. They know it's going to pay less. I believe they even discussed that in this report, that doctors are going to make less money. What medical school student wants to become a doctor to make less money, to get 50 visits over the course of just a morning, to have to see 50 patients in the course of a morning? That is, exhausting. That's incredibly exhausting. So if you believe that this Medicare for All system, sure, okay, we got $5 trillion of savings. Let's say that's the best case scenario. I'm just going to leave out all the stuff I just said, which was the fact that if you see that many people, the healthcare costs are going to be a lot higher than you actually believe, right? Because all of these visits cost money in some way, shape, or form. If you believe that you can get any standard of care in that 5 minutes, then you are completely mistaken. And if you believe a doctor wants to go to medical school to get that kind of job, that's absolute nuts. That's absolutely crazy. Let's continue. Now down here, they're actually addressing what some of the financial problems can be. Specifically right here, the new pharmaceutical agents and medical technologies that emerge also pose financial dilemmas to the health system. Currently, the Taiwanese healthcare system does not take in enough money from premium payment to cover the entire healthcare provided by the hospitals and other healthcare personnel. The government often has to provide additional funds to keep the system running. The system is complicated by politics because any premium increase would require approval of the legislative yuan. So this right here completely proves my point. Along with the fact that doctors are going to have less time to actually see patients, doctors are going to be completely overworked by seeing, in this case in Taiwan, about 50 patients in just a morning. Now they're going to be dealing with substandard equipment and pharmaceutical drugs because all of the innovation that we have in the healthcare system, and for all the healthcare system's faults, probably has the most amount of innovation of any field in the world, maybe aside from the military. Well, now there's not enough money in the system coming in to actually pay to get all of those innovations, from drug companies to get new drugs, to get new medical equipment, to get new testing equipment. What happens when all these MRI machines start to fail? What if a new MRI machine comes out that's actually safer than our old MRI machines? What happens if a new cancer drug is discovered? What happens if a new Alzheimer's drug is discovered? Well, guess what? We don't have the money in the system to actually pay for those drugs to be brought to market, or for anybody to even research those drugs in the first place. What if there's a innovation in surgical technologies? What if we can somehow make organ removal safer? What if we can make heart surgery or brain surgery safer? What if we can make just standard surgeries safer, like gallbladder removal surgeries, or even tonsil surgeries, or knee surgeries? What if we can have the tools to make all that safer and come with less recovery time, but we can't afford it because the system doesn't allow for enough money to pay for all that stuff? That's highlighted right here. That's highlighted right here in this report. The fact is that Taiwan's healthcare system has been so bad with all of these things that I just highlighted that even with all of these great unicorn jizz fantasies of everybody's got healthcare and we can all go to the doctor, well, it's been so bad now that they actually are entertaining the idea of reverting back, or they might have already done this, to a hierarchical medical system, which is essentially the system that we have here in the States that is being blamed for being so inefficient with all of this wasteful spending. Essentially having a system where you go see a doctor and they refer you to a specialist, and then they have cross referrals and you got to go for one opinion to another opinion to another opinion. Essentially the healthcare system we have now, Taiwan has to revert back to that after years on this Medicare for All system because that system was so bad, right? And that's what this study right here is talking about, the impacts of the hierarchical medical system on national health insurance on the residents' health-seeking behavior in Taiwan. And The reason they have to do this is because the personal care expenditure of the National Health Insurance Program increased from $252 billion in 1998 to $593 billion in 2016, indicating a growth of almost 2.5 times. So, like I've been saying, that $5 trillion number, that might get completely wiped out because the cost of this system might be so much more than we think that it doesn't even matter how much we initially save. It's going to cost more because it's so inefficient. Healthcare expenditure by clinics has also increased from 162.7 billion points in 1998 to 392.4 points in 2016, a growth of 141%. The average healthcare cost per person per visit has also risen. From the trend of national health insurance revenues and expenditures, safety reserves are expected to be exhausted by 2021, and Taiwan will face pressure to adjust national health insurance premiums, a challenge that is exacerbated because the country is now in an economic recession, which a lot of economists believe that's what's going to happen in the States. The income levels of employees and the insured are also not increasing, and there are limits to the growth of the gross domestic product. If prices are constantly rising, the public and hospitals must jointly reduce expenditures on unnecessary healthcare in order to avoid increases in NHI premiums. That's the problem, is that this fantasy of just opening up healthcare to everybody, you're still going to have the, for lack of a better term, the invisible hand of the market. You're still going to have the supply and demand forces working where, well, if everybody's going and there's all this demand, well, we have to raise prices. You just have to do it. That's what's happening. You have to, bring in more revenue, and you have to also discourage people from just frivolously going to the doctor whenever they get the sniffles or constantly going to fix a problem that might actually be much better handled by just adjusting diet and lifestyle. After the implementation of the National Health Insurance Program, hospital crowding, regardless of disease severity, resulted in packed hospitals and overcrowded emergency rooms. Meanwhile, district hospitals were shutting down. Since 2017, the growth in numbers of outpatient visits for minor ailment services at medical centers and regional hospitals has been limited. The number of outpatient visits could not exceed 90% of those in 2016, or the National Health Insurance Program would not reimburse the costs. As a result, the upcoding of diagnosis for minor ailments by hospitals to reduce the number of patients under primary care was instituted to respond to the cuts in reimbursement. So basically what the hospitals were forced to do was to upcode just minor things that people were coming in for. Upcoding is basically if you come in for a cold, the hospital might say that you had a serious injury, that maybe you sprained an ankle. If you came in for, like a routine procedure, they might say that you came in for brain surgery. Which, these are extreme examples. I just don't have any better examples off the top of my head. But this is considered medical billing fraud. This is a serious crime under Medicare rules. You can't upcode like that. But because the hospitals were not able to bring in enough revenue, they had to start upcoding to start compensating for all the money that they needed just to keep the lights on. This is a cautionary tale of what can happen in a Medicare For All system in a place like Taiwan. Now imagine that scale to the severity and to the numbers that come with the Medicare For All system in a place like the United States. So when Kyle Kulinski calls these insurance companies middlemen mafia, and when we start talking about how we're just going to do away with frivolous healthcare spending on people like administrators, you have to understand, doctors need administrators in their office. They need the secretaries. They need the medical billers. They need the coders. Could you do this more efficiently? Absolutely. But the problem is that this is an industry in itself, okay? This industry actually, if you want to get technical, look at people who work in just basic medical records and billing, okay? Just basic technicians. This is a $40,000 a year job that you need really no education for, okay? And if you cut these jobs, you're talking about a 215,000 job loss, okay? That is that is not good for any politician, right? That's just basic entry-level people who you're going to be kicking out jobs if you start essentially getting rid of a lot of administrative costs, right? Then you also have, the medical service managers, and that's actually a really good job. That's a almost $100,000 a year job that you only need a bachelor's degree for. And almost 500,000 people in the country have that job. So these aren't just these are jobs that keep Americans employed. You want to talk about job growth, labor growth in the labor sector? I mean, medical billing and medical administration is incredibly important, okay? Along with forcing a doctor to see upwards of 50 patients in a morning, now you're forcing them to also do all of their paperwork, all of their coding. If you think insurance companies are bad with their bureaucracy, with medical billing and coding, you have no idea what you're in for with a government-backed healthcare system, because it's going to come to a point where they can't just approve everything. Maybe at first they will, but like we've shown, the inefficiencies in that model, the exorbitant costs in that model are so bad that now you have hospitals committing fraud because they don't have the tools to actually do the job right. And one more thing that really steams me about people who call these arguments like Republican talking points, you talk about things like wait times in a Medicare for All system. I mean, again, I'm just doing the basic math. If everybody wants to go to Mass General Hospital because now they have free healthcare and they can do that, naturally, unless they start implementing thousands more doctors in Mass General Hospital or in any of these good hospitals that aren't rated 2 stars on Google, you're going to have wait times. And that's proven here in a recent survey that was done on by the Parliament in UK. I believe it's parliamentlink.uk or parliament.uk, where they're essentially evaluating the Medicare for All system or the single healthcare system in the UK, and you can see that the hospital waiting list for hospital treatment has grown to record levels of 4.5 million people, or 4.5 million. The wait times, 4-hour wait times, have dramatically improved. You can see here from this graph from 2011 to 2019. I mean, it goes from 5% to 25%. So look, my point with all this is that I get it. The idea of having a Medicare for All system sounds like a great idea because we can all go to the doctor and we can all be healthy. But the problem is the actual details that come with this. Maybe you can put a report together that says you can save $5 trillion in the healthcare system by getting rid of a lot of wasteful spending. Maybe that's possible. But at the same time, you have to also figure in all of the hard facts. Just the simple math that if you put 330 million people on the same healthcare plan, everybody's going to want to go to the same doctor. Everybody's going to want to get the same treatment. And if we don't have doctors with the financial incentive to actually become doctors, we're going to have a shortage of doctors, a serious shortage of doctors in the healthcare system. And that could be detrimental to the point where hospitals are now committing fraud in places where they have this single healthcare system or single payer healthcare system because they just don't have the tools. They don't have the innovation because they can't afford it. There's just not going to be enough money unless you absolutely gouge not just the upper class, but the middle class of taxes to the point where this completely offsets itself. They want to say, yeah, you're going to get a tax break, or yeah, your taxes are going to go up, but you're also going to get a $5 trillion tax break. But when you break that down, especially if you don't go to the doctor that often, this is an awful idea. So I'd love to know what you think about this. Are you for the Medicare for All plan, single payer, or do you think this is just an awful idea? Did you think before you watched this video that Medicare for All was great and now you're second guessing that? Please let me know down in the comments. Also, don't forget to give the video a big fat thumbs up because you enjoyed it. Subscribe to the channel and please share this video on all your social media networks. Thank you all for watching. I'll catch you on the next one. Peace.